Hey guys, it's the Doc, and here's our next installment of the hashtag Ask Dr. Mudgil series of posts. And this one comes in from Reddit, and it's a good one. Here's the question. New dermatofibroma, a question about timings. I have what I'm quite sure is a dermatofibroma that has come up on my chest after having a pimple in that spot that I picked at a couple of times. I have one also on my arm, and I had one on my leg for years, but had it excised. I have a dermatologist appointment in 2 months' time, but since this new one is only about 3 weeks old, is there any reason to have it seen ASAP in case it responds better to treatment? Really hoping laser will be an option. Or would it make no difference whether I have it seen now or in 2 months? Thanks. Well, that's a great question. So it sounds like you have been around the block and you have a pretty good sense of what's going on. And it is possible. You're right. You might have had a pimple there. A dermatofibroma is essentially like an inflammatory scar that turns into like a growth. And, frequently there's like at the site of like a bug bite or an ingrown hair, or in your case, maybe even a pimple that causes it to form. Your instincts are actually good. Like usually, when a problem arises, treating it as soon as possible is the most judicious way to go. But the truth is, it probably doesn't make a difference in this case. Really, if it is in fact a dermatofibroma, which your dermatologist will tell you when he or she sees you can either do nothing about it, which is perfectly fine because they're benign, harmless growths, or if you want to treat it, really the only thing you can do is surgically remove it. It's the only thing that works. There are really no great laser options, or quite frankly, there's really no effective laser options at all for dermatofibroma. So whether you get it to be seen now or 2 months from now, I don't think is going to make a difference in terms of management. So I would say if you like your dermatologist, I would just wait it out and see him or her in 2 months, and they'll go over options with you. I hope that answers your question. Let's get it.